basic, right? How does CRM play a role in the healthcare industry?
When we talk about CRM, and maybe in our parlance, we call it patient relationship management. It basically, I think the fundamental principle is to manage and improve customer interactions. And that being the premise, right, I'll tell you some of the areas where CRM plays a very crucial part for healthcare providers. Um, the first is patient engagement. When you talk about the very basic of appointment booking, doctor appointments, orders appointments, pharmacy, online pharmacy deliveries, you'll be able to book all these using a CRM. Patient education or sending the right message to the patient based on the context. Uh, CRM will actually help us to ensure that there is a unified data management that is actually available so that the contact center agent who's actually viewing this particular data gets all the details into a single frame so that he or she will be able to advise the customer in the right manner. Um, then we talk about feedbacks and surveys. Today, what we have done is we basically pump out all the NPS as well as the CSAT scores back into the platform so that when the agent basically interacts with the patient, they are able to understand what, what sort of patient is this, have they been, what are the past complaints that they actually find, and able to take very informed calls. Unification of complaint management. In healthcare, right, there are a number of moving parts. You have virtual, you have physical, and there are various touch points in the hospital. So it is very important for us to ensure that customer complaints are taken very seriously and addressed in a timely manner. So ensuring that omni-channel complaint management system is in place, which will basically unify all this and bring it to a single platform so that we will be able to resolve customer complaints in a timely manner. And last but not the least, but then from a marketing cloud standpoint, ensuring that we are able to do campaigns with ease, in a few clicks, and ensuring that if you're doing a campaign across multiple media channels, or let's say social media channels, if you want to understand campaign performance, right, you can use tools like Datorama to get a single consolidated view. So these are some of the use cases what we have implemented in our patient relationship management, and that has actually helped us tremendously to improve the overall experience.
Super. I know you started this whole digital transformation journey sometime last year. How did you go about it, Kumar? And my favorite part, why did you select Salesforce?
So I think I joined NH in 2015, and we are big believers of technology. It starts from our chairman. Our vision is to provide quality care or high quality care at affordable prices to a broader population. And India, I'll give you an India context. I don't know how many of you know this. We have one nurse for every 438 patients. We have one bed for 1,000 patients. We have 64 doctors for 1 lakh patients. Now, we can start building hospitals or let's say medical colleges, have more number of people join this medical stream. That's not going to bridge the gap because we are a population of 130 crore or one population. So as we start all this, we will not be able to bridge the divide. So what can be used as a force multiplier? It is purely technology. And our chairman firmly believed that if at all we are going to bridge the care and take healthcare to the masses, in urban areas you get super care, but then how can we basically penetrate tier 2, tier 3? And that's where we have to employ technology in a meaningful way. So that said, our digital transformation journey started in 2015. We segregated that into phase 1 and phase 2. Phase 1 itself was for 5 years, and it was divided into 3 different stages. First 2 stages basically involved cleaning up your own house to ensure that things are in order. And in phase 2, another beautiful thing happened, that we took control of our technology and we said that we will build our own technology. We have the domain expertise. Why can't a provider be a technology partner too, right? So we built Atma, which is the soul, or which is the health information platform, and we built Meda, which is the advanced analytics and AI platform. And you need both heart and the brain for your body to work together, right, in a unified manner. So we built that out. Not only we built it, we rolled it out in a span of 10 months, and that basically completed phase 1 of the digital transformation journey. But one of the key areas that we really wanted to transform. Because today in digital, what is most important? It is the end consumer, it's the end patient, and that's whom we are working for every single day, every single minute. Right? So everything has to be centered around the patient, and any technology that we stitch has to seamlessly, fit in. So we had a pretty broken patient relationship management. We have tried various tools on open source and all that. We have had our place with all those previous tools. So we said that we need to transform this experience, and we said that let us take a look at what are all the available CRMs that are there. First, we understood what are our own problems. Before basically understanding any product capabilities, enterprises have to look at what are our, first look within to understand what your problems are, note it down, understand what are some of the key requirements, and then match it with a product capability. We did a very detailed evaluation using a very scientific tool. It's called as Pewmetrics, and identified. And in that product classification, Salesforce came out number one. But the other thing is the way in which Salesforce account team basically engaged with us at each and every part of the journey. We also understood that the depth of experience that the product basically brings and the team also brings in. So the phase two of the digital transformation is all about delivering customer delight, delivering superlative patient experience online as well as offline. So and in that journey, we have started with Salesforce. We were able to successfully roll out in a span of 6 months. Of course, we had a 4-week schedule slippage, but that's fine. In these large-scale products, projects, it's all in the game, I would say. But then we were able to successfully roll it out and stabilize the platform in a span of 3 months.
Fantastic. What were some of the challenges or learnings that during this whole journey that you would like to share with the audience over here, Kumar?
No, I think learnings or challenges, our CFO is there, Sandhya is here. The main thing what we decided at the leadership level was to ensure that there are appropriate governance controls that are actually put in at each layer, which means that we had run our monthly governance cadence with the chief marketing officer. We ensured that weekly WSRs are basically done, and they're all done diligently, and every part of the project was tracked. And I was, it's like this government has this officer on special duty, right? So here the CIO was also deputed as the officer on special duty to get the strategic project off the ground. And that was a directive from the operations committee to ensure that this project, no matter what, is very key to the organization. It has to take off. So I used to sit in each and every WSR call to ensure that even to the minutest detail we used to see. But then one key thing that we did was to adopt a methodology. In technology, right, you have 5 pillars, right? Assess, design, construct, implement, operate, and review. We did this to perfection. We spent a lot of time on assessment and design. So a lot of time was devoted to planning before we ventured into construct and implement, right? We were able to do that, and we were able to successfully roll out. And along the way, while challenges happen from an integration standpoint, many of the APIs, application programming interfaces is another, because this system has to talk with a multitude of systems. So what is the API methodology? Enabling your partner to understand your data model of your core platform. How do business processes basically work? So those were all some of the challenges that we basically had, but we were able to effectively navigate each and every problem because we invested time in the assessment and design phase. We were able to large extent eliminate or basically find solutions to this and successfully roll out.
Very interesting. Very interesting. Of course, today's sessions are all about AI. We had a couple of customers come and talk about it. But how do these emerging technologies, AI being one of them, how do they form a part of your vision or a vision for a CIO in the healthcare industry?
So I think emerging tech plays a very critical role, when it comes to healthcare IT. They are all intertwined. and not a day goes by then we don't talk about AI. Everywhere it is this. It is like ether. Everywhere we keep talking about AI. But then, if you look at AI and machine learning, let me give you 2, 3 examples of how we are trying to make a difference. We've heard about electronic medical records. We've heard about doctor burnouts in the Western world. How we are trying to do that is in our platform, in our homegrown platform, what we're doing is we're doing a speech to text to construct the EMR. We basically give a white canvas, ask the doctor to do a speech to text. The AI basically does the entire conversion. It then populates everything into the specific widget. Now imagine the amount of time that the doctor saves, then imagine the reduction in burnout, right? Now the doctor is able to see more patients and they are able to, and the most important thing from a hospital standpoint, we are able to get that data in the system. And if we have data in the system, then we are able to generate meaningful insights, not only for that patient, but also for the entire population that is actually there, right? So simple interventions. Second is basically discharge summaries. Today, in any hospital, if you say discharge takes several hours, so and discharge summary preparation takes at least maybe a couple of hours. So we have come out with a generative AI which will basically generate the first draft of the discharge summary. Now, you don't need to have a team. All your team is going to, your doctor or your residents are going to do is to review this entire thing and basically sign off at multiple levels. Dietary advice generation. There is a small GPT icon where you actually click in and it basically generates the dietary advice. Of course, it basically gives a prompt and then it is up to the human to basically correct it. Medical coding. It will basically take away the mundane work of doing ICD and SNOMED. And we have these kind of standards to code saying that if you have fever, you have to code this way. If you have a knee replacement, you have to, there are CPT procedure codes that are actually there. So, and whatever I saw in the Einstein One platform and the other use cases, I feel that context-based AI is very important. When you talk about Service Cloud, I think it makes a huge difference. So we are looking at, we have just started. It's like we are new kid on the block, right? We have just started, but then give another 2 months, we should be able to switch gears and basically identify areas of automation, areas of workflow improvements, and see how we can harness AI in a proper way. And then personalized medicine, we are coming out with other solutions to effectively target people. I won't say target people, when I effectively reach out to people and ensure that we give the right insights. A couple of other emerging technologies, 5G is coming up in a big way. And in a country like India, where there is bandwidth crunch, technologies like 5G can really help us to take healthcare to the masses, right? Giving more bandwidth will then help us to have all the digital health interaction basically happen in a much more seamless way. And then last but not the least, in medical field, we see a lot of robotics. The Da Vinci robot is one which is where we have done several thousand surgeries now using the Da Vinci robot, minimally invasive, less blood loss, faster recovery. If it is faster recovery, your A loss is lower. If your A loss is lower, you're able to give the bed to a patient, and then it in turn improves your revenue too. Right, and then the last use case is, or even from a robotic standpoint, there is a knee replacement robot that is actually there, where you can exactly do the treatment planning, and basically you leave it, and the robot will basically do the work, right? So these are advancements that are actually happening, and there is CRISPR and many other technologies that are actually there, but these are some of the things which we feel relevant and which is India context, not the world context, but India context, and how it will make a difference from our country standpoint.
Kumar, always a pleasure talking to you. Would have loved to ask you 1,000 more questions, but given the paucity of time, thank you so much.
Thanks, Akshay. Thanks, everyone.
Thank you.